Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at the Premiere Psychiatry Center in Ashburn, Virginia, discussing the benefits of psychiatry and how it can help with ADHD and significantly improve your child's life with one of this region's top psychiatrists, Dr. Sabah Hadi. Dr. Hadi received his psychiatry training at Chicago Medical School, Rosalinda University, as well as his child psychiatry training at Baylor College of Medicine in Houston, Texas, and again is widely recognized as one of this area's top psychiatrists. Welcome, Dr. Hadi. It's a pleasure to have you on our program.
Thank you.
Now, it's your first time, in fact, on the Top Doctors Medical Interviews, and we have a few patients that are going to be coming up a bit later, and we have you on, Doctor, to enlighten us and educate us on a very prevalent problem in society, namely children with ADHD. And I wanted to begin by having you please tell us what that is and why is it so common?
Yeah. Well, thank you. I'm pleased to be on your program. ADHD stands for Attention Deficit Hyperactive Disorder, and in fact it is widely prevalent in our society. The latest research indicating that it's about 12 to 16% of our kids, they will have that at certain point in time in their lives from age 6 to 17.
My God, that's a lot of kids out there.
Surprisingly high.
Yes, talk about millions of folks.
That is very true.
Now, who would be a good candidate that could get this? You touched on it briefly. You said kids between ages of, 6 through 17. I take it that's generally the range one could start seeing symptoms and actually get this disorder?
Yeah. These are the studies lately, and the latest study, as I mentioned. But, kids can show symptoms as early as probably 3 and 4 years old, and it start to impact their life. So the key issue here is how this ADD or ADHD impact their life and their functionality.
Now, for the folks out there, the parents that are watching Dr. Hadi, who have young kids within that age range, what are some of the symptoms they should be watchful for to indicate that their child may suffer from ADHD?
There is in fact, list of signs and symptoms, and as I mentioned, it's the most important thing is if these signs and symptoms start to impact the child life and well-being, and that will affect 3 areas in child's life. Number 1 is school, and number 2 family, and number 3 is the social, meaning social peers, meaning any social interaction.
Oh, so these are the 3 areas to watch for it.
That's right.
And it's on in the details or in the list on your website, I take.
That is very true.
Now, what are some of the most common causes of ADHD?
Well, according to recent studies, ADHD is in fact does run in families. You will be surprised that if you dig into history, you can see it's genetic. It does run in families. So most of the kids, they did get it through their genes. Now, the issue and the question is, does it impact their life? Does it affect their development and well-being emotionally, socially, and academically? And these are the areas in which we check, and accordingly we decide strategies to treat them.
Are there different levels of severity when it comes specifically to ADHD?
Right. ADHD, in fact, classified according to the DSM-4, criteria to 3 kinds of ADHD. It's the ADHD inattention subtype, and there is the ADHD, the hyperactive impulsive type, and there is the combined type. And they classify it also into the mild, moderate, and severe, depending on how much it impacts the kid's well-being, as I mentioned, in the 3 domains: social, school, as well as family.
And what would you say, Dr. Hadi, are some of the more effective treatments to combat the ADHD disorder?
There are, in fact, many or different approaches. There is the behavioral interventions, there is the school interventions, which include modifying the environment to meet the child's need.
Yes.
And oftentimes in the mild cases, that's what we recommend, and see if we can meet the child's need or needs. And then if still the child having hardship or hard time functioning, then we will consider other options. And one of the best options also considered, which it has some stigma, with it, is the medication, and which is in fact a safe, as long as it's reviewed, discussed with the pros and cons, and the parents will be well informed. So what we see, in fact, significant improvement when a kid or a child treated with certain type of medication.
Very interesting. And what types of results can we expect from these treatment options?
You will be amazed. Significant improvement. And kids will testify, in fact. When you hear it from a child who is 6 or 7 years old, that I feel much better, their confidence in themselves much better, their academic in school and their social relatedness to peers much better, they are accepted, within their peers much better.
Yes.
As well as their family life way much better, from the daily routine to frustration tolerance to early morning routine to getting homework done. These are, these issues impact the family life significantly.
That's certainly good to know that we have treatment options that can produce those type of results in so many kids out there. And speaking of results, we're now going to meet a few patients of Dr. Hadi, and they're going to tell us about some of their experiences. Welcome, Matt. It's a pleasure to have you on our program.
Thank you very much.
Now, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us, Matt. And I wanted to begin, if I may, what brought you here to Premiere Psychiatry Center and Dr. Hadi?
I was going through some personal issues. My previous care provider was not meeting the expectations I needed, and Dr. Hadi was certified in what I needed.
And I understand from talking to you off camera before this interview that basically you were having a very difficult time in life itself, as far as the day-to-day things, the motivation, the drive or lack of, just weren't what they used to be for you, I take it, some time back. And it was a rough period before you came here.
Yes, it was. It was quite difficult for me. Very life-altering issues.
So because of that, obviously they were impacting your life on a great level. And then you came here, and can you tell us briefly what took place?
I met Dr. Hadi the first meeting. It was very good. I thought he was very nice right off the bat. I liked him right away. He took away adjusted medications, and since then, I think I started seeing him 2 or 3 months ago.
Okay.
Since then, I haven't felt I haven't felt this good in very, very long time. I would say years. So in the 3 or 4 months I've been with him, I haven't felt this good. So
that's great to hear. And I understand you were taking medications before you came to Dr. Hadi, but they just weren't doing the job for you.
Right.
So then obviously he adjusted based on your specific needs and requirements and customized a solution that has changed your life for the better. You're a new man, Matt.
Yeah. I'm back in school, and he's the changes he's made on the work that I had done previously with other care providers have just done wonders for me, motivated me to go back to school and all that. So I'm very happy with it.
Well, I'm happy to hear that. And lastly, before we let you go, Matt, for the folks out there that are watching, what would you tell them about Dr. Hadi and his practice out here?
Well, for me, it's convenient to get to. He's the very first time I met him, he was here before regular office hours to meet me early. And just the level of attention he pays to everybody. He always remembers what we spoke about last time. He pays a great deal of attention, and I really appreciate that.
Well, on that note, I'd like to thank you, Matt. Sounds like you strongly endorse Dr. Hadi for the folks out there based on your experience that you've had with him.
Thank you.
And good luck to you in school, and thanks for joining us and being a guest on our program.
Mm-hmm. Well, I appreciate it very much.
All right, Matt. Welcome, Shayna. It's a pleasure to have you on our program as well.
Thank you very much. It's my pleasure.
Now, I understand you have an 8-year-old daughter.
Correct.
That you brought here to Dr. Hadi.
Sure.
And can you please tell us what she was experiencing that had you take that step?
Okay, she was experiencing lots of difficulty with school, mainly.
Yes.
And with our life, daily life, we can adjust to her needs, but with the school, they were not able to.
So I understand she has ADHD?
Correct, and that was her diagnosis.
And she's 8 years old?
She's 8 years.
So when was this diagnosis made? Recently?
It was made about a year ago.
All right, and so when did you start seeing the symptoms of ADHD?
Well, we start seeing symptoms as early as 4 years old, but completely we're denying it until she started having some difficulty with her school homework and school. So then we decided to see a child psychiatrist who was board certified in treating these kind of difficulties or problems with kids, and we got to Dr. Hadi.
And what treatment did your child receive, or is she receiving?
She's currently receiving medication that she's taking daily, and that's helping her a lot during her school performance, assignment, her relationships with her classmates and teacher, and with her mom and dad, after all.
That's wonderful. So it's working very well, in other words.
Absolutely. We're very blessed.
And lastly, for the folks out there that are watching, Shayna, who have kids that are going through this very prevalent problem, ADHD, what would you tell them?
Well, I tell them, please don't hesitate. You can call Dr. Hadi. He will be very helpful, and his environment and the staff, they are very helpful and they're very friendly.
Well, on that note, I'd like to thank you for joining us and being a guest on our program as well.
Thank you very much.
We're now back with Dr. Hadi. I must say, some great work, Doctor. In Matt's case, he basically had come to a dead end in life at such a young age, so depressed, as he mentioned, not in school, so on and so forth, and suddenly he has his energy back, he's re-enrolled in school, and he feels like he's got his whole life in front of him.
Yeah, it's impressive. When you see, significant improvement, that is in fact very rewarding. And that's why we also decided to take this interview, because part of it is educating the society and help them, about, the impact of mental health, issues, and to help alleviating the stigma,
Yes.
the society has, with it.
Yes, indeed. It's not, and you look over at Shayna, who we interviewed as well. I mean, you're talking about an 8-year-old girl who suffers from ADHD, and how there were symptoms even as early as 4 in her particular case, which is something you had mentioned earlier in this interview, that even though the range typically is between 6 and 17, in some cases the symptoms could even start showing up earlier. And then Carmen, who obviously is very pleased now with how she is. So great work, Dr. Hadi, and I wanted to follow up by asking you, are these results from these treatment options permanent, or what's involved as far as curing this problem?
What we noticed, and what the data research also showed lately, is that 60% of those who are diagnosed with ADHD, they continue to have ADHD symptoms that will impact their functionality in their life after the age of 18. So that means, you know, there is a great need to continue some kind of treatment, okay, and to acknowledge your symptoms and be aware of it so it doesn't affect your function later in life. And that will include college, that will include work, that will include career, you know, deciding what career to go, okay, which is in fact significant and very important, because people, they live their symptoms and they think that is normal, that's part of them. In fact, it's treatable and they can do much better.
Yes, indeed. They can actually do everything they wanted in life instead of feeling like, you know, they just can't take that next step because it's holding them back in many ways.
Mm-hmm.
Now, we're literally out of time, Dr. Hadi, but I wanted to ask you before I let you go, you and your practice, Premiere Psychiatry here in Ashburn, Virginia, have certainly developed a reputation for excellence in patient care. Obviously, you've had a few patients of yours on earlier here who spoke glowingly of the work that you've done to help each and every one of them, not to mention many others in this area. I just wanted to ask you, what would you say, Dr. Hadi, helps separate you and your practice apart from many of the others in this region?
With all due respect to all practices and providers in the area, we in fact unique and we are different in several ways. One of them is that, you know, I pay special attention and I give the time and the attention directly to patients instead of, you know, a middle person. So I do answer phones immediately. In fact, I do respond to their calls. I schedule them immediately, get them in, even if I have to be late or if I have to come early. So I'm very flexible. So when it comes to accommodating clients' need. On top of that, if you're really looking for someone to evaluate and give you a good recommendation or informed, you know, consent or recommendation about, you know, modalities or ways to take care of your kids, just go to the one who knows the field, the one who is specialized in the field, and a board-certified child psychiatrist will be the one. So I am a board-certified, in fact, child psychiatrist as well as adult psychiatrist.
Yes, indeed. Got very strong credentials, as you just touched on. You're double board certified in both adult and child psychiatry. Not to mention, you really seem to go the extra mile. You treat your patients like family, basically, and it shows, doctor, the level of care that you show.
So we do give specific and special attention to each client. We treat them as individuals, not as statistic or as a business.
Yes, indeed. And on that note, I'd like to thank you, Dr. Hadi, for joining us and enlightening us on a very prevalent disorder, namely the ADHD, and how it affects so many kids. And now we know there are some very strong and effective treatment options that can help so many of these youngsters. Thanks again for educating them today, and we'd love to have you back on in the future.
Thank you.
Folks, we also have Dr. Lavrini with us, who's a very well-known and reputable licensed clinical psychologist, and she just wants to share a bit about the services and treatment plans that she's been providing here at Dr. Hadi's office. They both work together to help so many folks out there. Welcome, Dr. Lavrini.
Thank you.
It's a pleasure having you on as well, and I just wanted to have you on for just a couple of minutes, basically. Briefly, if you can tell the folks out there watching some of what you offer and provide that could help them.
Sure. My practice is called Psych Ed Coaches, and we are an ADHD and executive function coaching practice. Okay. So if you think about executive functioning as the brain CEO, we really specialize in issues such as organization, time management, planning and prioritization, anything that really requires what the brain CEO might need in terms of regulation.
Very interesting. So for all those folks out there who fall into that category, you offer a range of services for them.
We do. We also do assessment and diagnostic work in terms of psychoeducational testing, learning disabilities, ADHD, and everything along those lines.
Now, on the ADHD side, Dr. Lavrini, are you talking about kids basically out there?
We
or
work-
also with adults?
Yeah, we work with children, we work with families, and we work with adults, so we pretty much span the ages.
Cover everybody who
Yeah.
has that disorder.
Right.
All right, and for the folks out there watching that would like to find out more about your services, is there a phone number or website you can give them?
There is both. Our website is very detailed. I really recommend you check that out. It's psychedcoaches.com.
Okay.
So I can spell that out if you'd
Sure,
like.
sure.
It's PSYCH like psychology, and then ED like education,
Okay.
and the word coaches plural.
All right, so psychedcoaches.com. And then the phone number?
571-289-9729.
All right, well, on that note, I'd like to thank you for just popping in for a few moments and joining us and being a guest on our program.
Thank you for having me.
It's our pleasure.
All right.